Hey, welcome to the Go-To Physio Sports Massage series. In today's lesson, we're going to talk about my favorite techniques for the medial thigh mobilization. You can use this on adductors, any kind of issues with the groin area. Very effective at desensitizing some of the pain experience. As always, use this responsibly. Use the 80-20 rule of the go-to therapist. 20% of our time is only focused on the symptoms, okay? Desensitizing the symptoms. To get lasting changes, we need to find what's caused these symptoms to react like this in the first place. And that's where you find the true cause of the problem. If you want more help with that, head over to thegotophysio.com. I've got loads of tips and resources there for you, okay? So without further ado, here's my favorite techniques to desensitize the adductors and various other tissues in a sports massage setting. I'll see you on the other side. Okay, so for the adductors or the inner thigh, we've got some options here. So we can do a situation like this where we can expose a lot of that thigh here. And again, what I would do in this scenario is I would just put my hand on the bed, and again I can get a lot of his leg here. So just bring that knee higher up, Pete. Again, you can expose quite a bit of the adductor magnus, adductor longus, hamstrings here. And again, we're just sinking into the tissue and we can get some decent pressure through that very easily. Okay, so that's one way to do it. Okay, and again, I'm in complete control here. You know, I'm working very easily here, and I could do this pretty much all day. Again, I can chat to the patient, make sure that they're feeling okay with the pressure and depth. That's all pretty easy, okay? And again, it's only that proximal adductor where you're gonna struggle to get a little bit of access to on that scenario. But for the majority of people, this one is a nice one. It's a very tender area anyway, so just be careful with your depth on that. We've got some arteries, veins coming through here as well. So we just wanna be nice and steady with that. Appreciate, respect the person's response, but ultimately all we're trying to do here is we're trying to decrease the perceived threat, restore the ability to tolerate a load through these tissues. So again, we don't want that person to be in a predominantly sympathetic response where they're clenching and tightening all the time.